and this is something that I think will benefit you as well.
Uh-huh.
Um, I know you don't want to sound like a snake oil salesman and say, well, this can work everywhere.
Right.
But in orthodontics, where this is being used, a good deal of the demographic in the orthodontic treatment population are teenagers. Well, guess what teenagers have? Skin problems.
Yeah.
That intraoral device isn't going to solve the skin problems.
Right.
The
Right.
extraoral device will solve both
Right. Yeah.
because it's strong enough to get through the soft tissues.
Yeah. That's
So
exactly what our experience has been.
so
So,
I
yeah.
didn't I didn't ask whether or not you're doing orthodontics, but there too, when I was in practice, I did a lot of orthodontics, and we used a product called Excelident. It's
Okay.
micro vibration,
Yeah. Okay.
um, and I would, if I had photobiomodulation there, I would have used photobiomodulation instead.
Yeah.
Frankly, the unit is cheaper,
Right. Yeah.
and it has other uses. So,
Right.
somebody might think, well, why am I getting this expense? I don't, I don't know how. I mean, I think people will. You said they're going to go look on Temu, but I do think people will look at other options.
Yeah.
So I do think in your website, I think it does pay to overcome that preventively
Yeah.
in saying the reason we're using this particular unit, and you can't use the unit you buy on Temu, is that is unreliable. We have no idea what wavelengths are coming, and this is a medical grade, doctor
Yeah.
recommended
Yeah.
product. So I would I would
Yeah.
I would encourage you to use that kind of language in your um in in your on your website.
Yeah.
Um and
I'll talk to Josh
and
and Jake. We'll go get it. We'll get it on there. Yeah.
um and I would promote the use of it.
Yeah.
I don't know if you saw the letter that I sent to the Spencer Study Club about, maybe you know what? I might not have sent it to the Spencer Study Club. So I sent a letter out to people to encourage every one of their patients who has a unit, a
Uh-huh.
PBM unit, to start using it this week as we change the clocks,
Yeah. Yeah. That's a great
right? To
idea.
deal
Yeah.
to deal with seasonal affective disorder.
Yeah. Yeah.
So you're dripping them other applications
And
throughout the year.
that's exactly that's a great idea. I love the idea of doing that via like an email or
Well,
a
do you
newsletter or some kind. Yeah.
do you have a newsletter?
We do. Yeah. There we go. Yeah.
Per, perfect way,
Yeah. Because
including
I'm doing that with the patients in person as they kind of complete treatment. Is I'll say, so this we've helped get you feeling better, and we're about to turn you loose. Here's why you might want to keep using your red light panel, and I'll go into some of the other things that benefits that they'll see. I don't often lead with that, but I'll kind of foreshadow a little bit where I say we're focusing on this specific application. I'm going to tell you about some other things as we go along.
so what I would do is I like story selling.
Okay.
So what I would do in the newsletter is I would have like a little area where you have, you know, photo bio photobiomodulation or red vibe unit of the month, where you talk
Okay.
about all those cases that you've talked about where people have used it for other things, whether it's
Yeah.
postpartum or it's Guillain-Barré or it's, acne or
Okay.
hair growth. I
little
mean,
sidebar on that. Yeah, I
a
like
little
that.
sidebar of a story
Yeah,
of someone who's taken their red vive, used it in another application. So you're
yeah,
planting seeds. You may wind up having people coming to the office just to get red vives.
true. Yeah, yeah.
Nothing wrong with that.
Nothing wrong with that. Yeah. But yeah, Jada, back to your question, like technically with like extractions and that.
Yeah.
So, there's been two kind of main cases that I've used it so far, and I'm sure there's many more than this. But so you do extractions on somebody, and they have open sockets where you're waiting for things to heal,
Granulate in.
granulate in, so that you wait for the soft tissue kind of heals first, and then there's a longer healing period for the bone to kind of fill in that socket. And you need at least the soft tissue to close before you can continue with, in our case, we do a lot of these functional impressions. So a functional impression is you may start off with you took impressions of the patient's mouth, you poured up models, you cut the teeth off the models, and you made a denture that's ready to go in the day that their teeth come out, right? That denture is not going to be very comfortable because the shape of that bony ridge in their mouth is going to change as they're healing. They're going to have inflammation, and then it's going to shrink down, and a number of things like that. So, um, with our functional impressions that we do, there's a material that we will line the inside of the denture with that's soft, and it sets up slowly over about a 3 week period. And the patient's wearing the denture, so their movements are sculpting that material to kind of create the model of what that denture needs to look like on the inside to have a good, comfortable, effective fit for them. But you can't start using that when you have open sockets because that material would work its way down into the sockets. So the
Yeah.
sooner you can get the patient over the finish line of sockets are closed by soft tissue,
Faster you
suddenly
can.
you can start getting their denture to be more than just a bandage with teeth on it, because when they're first wearing it, they might have it in there for vanity reasons, but that's about all the benefit that they're getting out of it. So anyways, that's kind of application number one that I'm seeing for red light, is how do we get them over that um that milestone to that milestone quicker. And then the other one is, as they're being fit for the denture, it's normal for people to develop sore spots where the denture needs to be adjusted. Sometimes they come in and those sore spots are pretty sore. And so the quicker you can make those sore spots feel better, the happier the patient is. And that's also where I've seen red light really, like dramatically accelerate how quickly somebody's healing up from a sore spot in their mouth. So those have been the two things. It's been just with two cases so far, so this is all pretty fresh. But we we're working on a bundle that includes some PRF with bone grafting, which can also help accelerate healing and preserve some of the form of their bony ridge, paired with that red light panel. And we're going to offer it as like an enhanced healing and recovery add-on for um, extractions patients. You could probably be doing very similar things with implants, and we probably will be as soon as I have a case that makes sense for it here. So,
How
and
would
you
you
can do the
do?
same thing with
How would you
orthodontics.
use it?
Yeah.
Yeah. How would you use it with implants? That's seems like a new area as well that I'm seeing folks
Just having them
thinking
use it
about
extra
using it.
orally while they're healing up. So implants, you place the implant, and you usually have a multi-month healing period for a patient. It's not unusual for that to be as long as 6 months
Months.
for some patients. And so yeah, just them using that to accelerate healing around the implant is how I would use it. So very similar to the extractions. Or they've had extractions, maybe some bone grafting to get a site ready for an implant, and they're healing up in preparation for that implant placement. It could be there really throughout the whole journey for them, and then they're still using it once the implant's been placed.
That's what I'm interested in because that's uh, you are using uh, photobiomodulation truly is an adjunct to the entire treatment in terms of the process, especially because it is filling in the gaps of time,
Mhm.
whereas the patient would have to wait and wait with either pain or just
Yeah.
time and pain, and wait it out in order to get the full treatment. And if the result is farther out versus getting the result that they want, you know, as
Yeah.
it, it seems as that this is the perfect way to integrate PBM into the entire treatment, whether it's um, in the context of the dentures for tooth extraction and that process. If the dentures is the result, tooth extraction is part of the process, correct me if I'm wrong, and
Yeah.
using PBM as part of the overall is exactly where it would go to really condense that time and make the patient experience um,
Yeah.
even better. Is that correct?
Yeah, exactly. And it's empowering for the patient because you've just given them one more thing that they can do at home to help with
Mm-hmm.
their own healing and recovery, and
Yeah.
who doesn't like that, like it's they've responded well, I think in part because of that.
Yeah.
um but yeah, integrating it into the whole process. And then I think I need to do exactly what Michael's saying, and that is after that process is done, then have them get a steady feed of other applications for it just to benefit their overall health and well-being, or
Yeah.
they know somebody who needs it, that
Yeah.
doesn't need dentures but they just had a baby, or
Mm-hmm.
yeah.
So tell really quickly, for how does preconditioning, because you're doing that already for
Yeah.
TMJ. So where do you see preconditioning with PBM in this process, as we're talking about tooth extraction,
Yeah.
dentures and or implants? How important is the preconditioning part in there? And starting
So
the
I
treatment immediately.
I haven't done any preconditioning yet, but I've got a box that I need to open from Redvive over in the corner here because we've got a big panel that's going in the other office, and we're going to do the same
Okay.
thing that we're doing over here. So we precondition before we draw blood for PRF. Um, in the case of extractions, initiating those physiologic processes before the procedure even begins, I think is a great idea.
Mm-hmm.
So we're going to up regulate, stem cell activity, your mitochondrial efficiency, um, and so that's already more optimized as the procedure begins. And we know that we've got, what is it? Dr. Desai says a 7 to 10 day benefit that's
Mm-hmm.
happening. Yeah,
Yeah.
so um, that's great. And then the other thing that I've noticed with the TMD patients is they are more relaxed for the blood draw after the preconditioning. 10 minutes under a nice warm red light that makes you feel like you're sitting on the beach. Um, I just see the anxiety level come down in my patients that have some phobia of needles. My phlebotomist absolutely
Interesting.
loves it. And she's told me she's has an extensive experience in phlebotomy before she came to me. Um, but she said that she likes the result of using the red light more than she likes doing a warm compress over the area that she would be doing the draw from. So there seems to be some benefit there, at least from her viewpoint, and making the draw easier.
I think it's one of these things that the more you use it, the more you're going to find other uses for it.
That seems to be the case,
Yeah.
for sure. I'd agree with that. Yeah. My um I think I shared with you guys, we have baby number 5 due on Monday. And my wife hasn't been using the red light panel because, it's contraindicated for over the womb, hasn't been studied, but she's been telling me every day, I can't wait to use that. I can't wait to use that again. So, yeah, that may be something that I could even have her write something for the newsletter. How I couldn't wait to use it.
So there is research, and maybe Doctor, and I think I can get Rahul to send you the studies, but postpartum, there are
Yeah.
applications, and and there's there's a certain, I don't know if it's a contraption, if it's a set. I'll let Dr. Goldberg share it with you, but there is a certain I just called it a whole new creation, you know, of what he's done, and I'll have to send you a photograph in a text message here. But
Nice.
it could be applicable. But again, you know, just postpartum, I'm sure there's a lot of applications for faster
Yeah.
healing and faster recovery, even when it comes to mental and just feel good, you know,
Hormonal.
overall
Yeah. Yeah.
hormonal overall wellness. So it would be really interesting to hear what she experiences, you know,
Yeah.
as you're
My,
doing
I think
that.
I told you my grandmother uh, was diagnosed with Fuchs dystrophy, so degeneration of the cornea, and was getting to the point where she had double vision when she was driving, and she'd be sitting at church and looking at the pulpit and seeing two pastors up there, you know, and she was really down in the dumps about this because her doctor that she was going to was kind of just like, yeah, you know, it's probably just going to get worse from here, and you're in your 80s, and there's nothing, you know, you're not a good candidate for some of the surgical interventions. And so I hopped on Open Evidence and typed in Fuchs dystrophy, photobiomodulation, just to see what I could find. And there was, I think, probably a dozen studies that showed that it reversed the blistering that occurs on the cornea. So I got her set up with a panel, and she's, I think, about 3 months, no double vision. So she's been a happy camper as
Great.
well. Yeah.
Well, this has been wonderful,
It's been
Jaydev.
wonderful.
Thank you for
Yeah.
facilitating it.
No,
No,
thank
thank you
you.
guys so much again, and yeah, looking forward to many more. So enjoy your guys' evening. Thank you again
Okay.
so
You
much.
too. Nice
Bye
talking with
bye.
you.
Okay.